Welcome to the office.
So how's the pain level?
Good. You know, when I'm chewing, this morning I realized that when I chew on this side, it kind of clicks.
Okay.
When I chew on this side, there's nothing.
Okay.
But definitely, I didn't wake up with the headache.
Okay.
I haven't woken up with the headache.
Nice. No meds?
No, I haven't taken, I only take, if I take anything, it's Excedrin, but it's a half of Excedrin, but I just want to stop that altogether unless I really need it.
Okay. Back's feeling better?
Back's feeling better. Now the first morning, so I saw you Wednesday, Thursday morning I felt a little sore.
Sure.
And then, Friday morning and this morning, definitely good.
No workout, just walk, hike?
I didn't do weights. It was a mellow workout yesterday.
Body
Yes,
stuff?
yes. Stretch,
Okay.
push-ups,
Okay.
very
Stand up.
basic.
Let me
It was
see you
not
walk.
easy.
I gotta see you walk. Walk on your toes. Turn around, walk on your heels. Little different.
Yeah,
I'll take it.
yeah.
Have a seat. Let's continue.
Definitely is a little different.
I'll
Definitely
take it.
more flatter on the feet. I know, because I do know when I get more on my sides and I start to go like this, I'm like, whoa.
So even the feet are changing.
Yeah.
All right. So whenever hubby's ready to come in, bring him in.
Yeah. And my husband's a black belt in jiu-jitsu and
Oh,
Aikido
nice.
and judo.
I didn't
and
know that.
yeah, that's his passion.
Right on.
So our kids are all, they all train in jiu-jitsu. So, but my oldest, she only trains with men. So she's definitely,
wow.
she's very strong. And, but her hips are straight. You remember you saw her, you
yeah.
were like,
They were.
her hips were off.
Whatever you guys want to do.
Yeah. I gotta figure that out when they're gonna come in.
I used to take care of 10 martial arts studios in Arizona when I was interning out there.
Oh, right on.
Yeah, so all the black belts.
Yeah.
And it was kind of cool because every client that used to train there, after I started with them, they used to come to me, get a full spine analysis. I'd give them a copy of it, take it to their master trainer.
Yeah.
And that way it's not just if there's a limitation or something we need to work on.
Yeah.
Then at least the teacher would know. So they're not pushing them through an injury, so to speak. All right, so today we're going to continue on the tailbone, 6 points today. We're going to continue on the mid-back, 5 points today. And I'm getting up top. So everything has been reduced already in one visit. Right hand up, seatbelt on, and down. Look up. Right ear down. Try put your hands on your lap. There you go. On your lap. Just like this. There you go. Relax. Look up. Like butter. Look at the mess. There's the rest. Like butter. Walk it off once.
I love that.
And we're gonna go dig a second one.
Yeah.
Face down over here, please.
Okay.
1, 2, 3, 4, 5, 6. T6. That's the home run. Chin up. Well, that's why you'd be doing jiu-jitsu and all that. That's the home run. Okay, walk it off. That's fine.
Wow, yeah.
Foot's changing too, by the way.
Yeah. Wow.
You can do some nice sand walking. walking in the sand.
Oh, okay, good.
Grab barefoot. That's going to be really good for redeveloping the arches.
Yeah.
It's going to help the back. The uneven surfaces, uneven walking is good. Hiking is good. Things like that.
Yeah, because grounding.
Yeah, absolutely.
Yeah,
100%.
So,
100%.
okay,
Have a seat.
Okay, good.
So there's two little muscles that are called spinal stabilizing muscles. Multifidi and rotatory. They're shunt stabilizers. So you're not going to work them out specifically with an exercise, as I was taught. You do uneven surface walking or balance work, where you're on a rocker board or a Bosu ball or something.
Yeah.
And then have one of the kids mess with you this way, this way, this way, this way.
Yeah.
Neck is clear. Cool. Mid back is clear. Sacrum is clear. Just like that, Barb.
When you say clear, what do you mean?
That's a good question. So what the meter is picking up is heat from the inflammation at those joints, right? Where the pressure is. And so my job, and what I really do is, my job is to make sure that I find where that pressure is, clear the spine. What does that mean? And that's a darn good question, which I will explain. So let's take this example. Let's say this is the T6, mid-back. Okay? And let's say it's been misaligned like this for a period of time. 6 months, a year, 2 years, whatever.
Yeah.
These ligaments adapt to this position. So these ligaments shorten in the back and they elongate in the front.
Got it.
Okay. Now, the adjustments that we're doing here in this work is we're repositioning back on the pivot, the nucleus. So we set it forward, it clears.
Oh, got it.
Now, it's been like that for a period of time, so what does it want to do? It wants to slowly revert.
Yeah.
Each time, two things. Each successive or incremental adjustment holds better, number one, but it also depends on the movement and the changing of habits. So I had a patient just come, I've been taking care of her since she was a little kid, she goes to Davis now. She comes in, my neck hurts, does that make sense to what I was saying?
Yes.
So I want to explain this because this is really important. So she's like, it's here. It wasn't there. She's got a reverse curve, right? So it's going in the opposite direction, which I explained to her 5 years ago, 6 years ago. These muscles and ligaments have adapted. Check it out.
Isn't that what my neck is doing?
A little bit. Actually, a lot. So this is important for you to understand too. Okay? So let's take this example. So we're supposed to have a forward curve. This is the front, this is the back. If we have a reverse curve like this, okay, these ligaments in front shorten, these elongate. Okay, now we're like this, we're like this, we're like this. Okay, so let's talk about this specific. Now, her posture is bad, freshman.
Got it.
You know what I'm saying, right?
Yes.
So everything's different, everything's changing, we're studying in this position. Okay, now, it hurts here, Rahim, it hurts here. It's not there, there's no pressure. I adjust here. Okay, everything's clear. How does that feel? The movement's better, but it still hurts. Okay, well, why don't we try something different? Instead of slouching, why don't we sit up straight? Why don't we bring our belly button in and up? And now turn your head. Oh my God, there's no pain. So I'm showing her the posture down here is going to affect up here.
Yes.
So if we don't change the mechanics of our posture, then, and we don't change the sleep and all that stuff, right? Then what happens? Things go back.
Yes.
And the easy example, Barbara, is this, car alignment. You're driving your car, driving to work, driving wherever, you're hitting those same potholes. Car goes out of alignment, tires wear out.
Yes.
Tire wears out, bushings wear out, everything starts to wear out. You go to the mechanic, he says, okay, well, we need to change, I just want my tires changed. Well, he says, you need alignment. Why do I need alignment? Because things are wearing out.
Yeah.
So you get your alignment, you get your new tires, everything's good, you got your new shoes, everything, but you keep hitting those same potholes. What's going to change?
It's just nothing. It's going to go back.
So then this just becomes another thing you're doing. You see the difference?
Yeah.
So there are people who go for routine maintenance, weekly adjustments.
Yeah.
It's their choice. It's okay. But a lot of that is, if we can change the habits, then we don't need them as much. And the goal here is to get people fixed up, change the habits, and get on the way.
Yeah.
Make sense?
Yes.
Go. Sit up straight. Scoot forward.
Forward.
Now, bring your belly button in and up. This is a good practice when you're driving, okay? Hold the belly button in and up, have a conversation, be on the phone, drive, move your head to the, turn to the left. That's the right. Turn to the left, turn to the right. Good. Relax the stomach. Turn to the left, turn to the right. Is that different? I feel less motion going to the right.
Yes,
So
and it bothers me more.
So you see I'm showing you the same thing.
Yeah.
Okay, let me just make sure everything is clear up here. One more time. So number 1 is getting your adjustments. Number 2 is getting your movement. Number 3 is changing the posture. And actually very important is also making sure we're not eating stuff that promotes inflammation in the body, right?
Yes.
On your back, please. Do your feet. Raise your right leg. Raise your left leg. There you go. Sit up and turn. Let's check the jaw. Jaw time. Sit back for me, please. Sit up straighter. Scoop in. Look up. Slowly open. Open. Open all the way. Slowly close.
Oh.
There we go. Got it. Open slow.
Wow.
Let me do the machine now.
Yeah. Oh my God, I love that thing. Oh.
Stand up for me, please. Squeeze. Good. You good?
Mm-hmm.
Squeeze. Relax. Squeeze. There you go.
Mm-hmm.
Squeeze. Yes. Slowly open.
Awesome. Oh, what did you say about the deviated septum?
You want me to work on it?
Yeah.
On your back. So look, here's what I'm doing. It's right there. So when I go on the right to left, you feel that? This is the bone.
Uh-huh.
This is the septum right there.
Yeah.
That's fine. Look at that side.
Uh.
You feel that?
Uh-huh.
So when I go this way, right to left is fine. It's left to right that's stuck. Now, let's bring the... Breathe through the mouth, please. I'm going to be on the septum right there. Good. Got it. Nice. Nice. Breathe in through the nose. And out. Yeah. A little bit more. Can you handle one more? Gotcha. That did it. That actually clipped in a good one. Cool. So what I want you to do 2-3 times a week, you want to do it every night, you can. I want you to do steaming, boil a pot of water.
Like a neti pot?
No, old school. Boil a pot of water, cover yourself with a sheet, topless, sweat it all out, whatever needs to come out.
Okay.
Okay?
Yeah.
Walk it off, that's gonna, and you'll see stuff will start draining. And you'll report back to us next visit.
Okay. Wow, yeah.
Different?
Uh-huh.
What's different?
Got a little...
No, woozy?
Yeah. No, but you know, because sometimes I get... I haven't gotten it since Wednesday because I forgot about it. I get vertigo.
Okay.
In the middle of the night when I'm turning. All of a sudden I'll get vertigo. But I haven't gotten it in a couple of days.
You're all good?
Yeah. Wow.
So I want you to do your steaming,
Okay.
do all your other stuff, no weights.
Yeah. I know, that's so... But no, it was good. I had a good little, you know.
Change it up.
Yeah.
Okay?
Awesome.
You're all set for today.
Thank you. That was great.
Take care.
All right.